Hey guys, and welcome back to the Upper Hand. My name is Parker. I'm an OT and a CHT. Today we got John with us. He's going to be our model for today. We're going to use his arm and we're going to talk about elbow and forearm isometrics. Let's jump right in. So if you haven't seen our recent videos on shoulder isometrics, wrist isometrics, and even the isometrics for the intrinsics of your hand, go check those out. I'll include a link at the end of this video. So if you haven't seen those, make sure you stay tuned to watch those. So today we're going to talk about elbow isometrics first, and then we'll go into forearm isometrics after that. So for elbow isometrics, you're going to be working your bicep, your brachialis, brachioradialis, and your triceps. So first we're going to start with triceps. So what you're going to have your patient or you yourself to do is have elbow right in at your side. Usually patients kind of making a fist, but it doesn't matter. They don't have to be doing that. And John here is about at 90 degrees of elbow flexion, and you're going to come right underneath, not past the joint, the wrist joint, but right proximal to that wrist, and John is going to push down towards the floor, and you're going to resist that motion. You're going to hold that for anywhere from 5 to 10 seconds. Different therapists have different reasons why they hold a shorter amount of time or a longer amount of time, so whatever you prefer, that's fine, but usually around the 5 to 10 second mark. Usually you're going to do about 10 all the way up to 30 of those before you're ready to progress to some type of concentric contraction after that. All right, so just to give you a better side view, first for your elbow extension isometric, gonna again be holding on the bottom side of their forearm here, and again, don't cross that wrist joint, come right in here, go ahead and straighten for me, all the way, push straight to the ground, very good. You can see that tricep firing back here, and relax. So next we're gonna work on an elbow flexion isometric, and we know that with the position of the forearm, that will determine what muscle is firing the most. So with elbow flexion and forearm supination, we know that the bicep is going to be the muscle that is firing the most there. So if we want to work specifically the biceps, we're going to make sure our forearm is fully supinated for that. So we'll have John come here, elbow again right at that 90-degree angle. Forearm's going to be completely supinated. And John, if you don't mind, let's just pull your sleeve up just a little bit. That's why I got John to do this video. His muscles are a lot bigger than mine. So you're going to hold, again, right proximal to the wrist. Don't go distal to it, or then you may get some wrist flexors as well. All right, I'm going to push down. You pull up, and you can see that bicep firing there. Now, if we turn the wrist in, if we turn the forearm in neutral, now we're going to be focusing more on the brachioradialis. All right, so forearm's in neutral, I'm pushing down here, he's resisting that, and you'll immediately see that bulge come out right distal to the elbow. The last one, most times people don't work this muscle out quite as much, and people also have a tendency to kind of wing out when they do this one, so just make sure your patient or you have your elbow stuck to your side, forearm or palm is facing the ground. Coming right here, proximal to the wrist, pushing down, 1, 2, 3, 4, 5, and relax. That will be working your brachialis muscle. All right, and for your last ones that we're going to cover is forearm pronation and supination. We don't do these a ton, but you need to be able to know how to do them if you ever have to do them in clinic. All right, so we're going to have that elbow at 90 degrees. You got your forearm in neutral, so your thumb's kind of facing up towards the ceiling. And I'm going to hold right here, just again proximal to the wrist, and we'll have John try to turn his palm up towards the ceiling, and I'm going to resist that motion. So go ahead and do that for me. 1, 2, 3, 4, 5, and relax. Good. Again, do that 10 to 30 times, somewhere in that range, depending on if you're just starting out or if you've been doing these for a few days and you're getting closer to moving on to that concentric contraction. All right, next, forearm pronation, the exact same thing. You're just going to support in that same area, and you're going to resist the patient coming into that palm down position. Big thing here is make sure that elbow doesn't wing out as he's doing this contraction. All right, go ahead and try to go palm down for me. 1, 2, 3, 4, 5, and relax. This one sometimes hurts a little bit for the patient. If you can kind of watch here, go ahead and do that again. That's putting a lot of pressure on his ulnar wrist. So if you have patients with ulnar wrist issues, this may not be the best thing for them, or you may just have to modify the way you do it so that you're not holding here on that painful area. Okay, so we've talked about how to perform elbow and forearm isometrics if you're working with a patient or if you have a partner working with you. But a lot of times we want our patients doing these exercises at home, so you want to be able to teach them how to do this on their own. So we've talked about the elbow extension isometric first. Just have your patients on some type of table. Here you don't want their elbow and their shoulder hiked up or way far down. So get it, right at this level here where your elbow is comfortably in that 90 degrees of flexion. And you're going to take the pinky side or the ulnar half of your hand and you're just going to push down into this mat or a table. Same concept as earlier, 5-10 second hold, however many reps you want them to do. But you're still getting that triceps firing here by doing it on your own on this mat. All right, so that's elbow extension isometric. Then for your elbow flexion isometrics, you're just going to come under that table here and you're going to do the same thing. Remember, there's 3 separate ways. We had that palm down, we had the thumb up or forearm neutral, and then we had the palm up, and we're going to do all of those the exact same way. If you're on a hard surface, sometimes you may need to grab a towel and have them put that under there so that it's not hurting their hand when they're doing these isometrics. Okay. Forearm supination, a lot of times the patients can just kind of hold themselves and resist, but say something's wrong with the opposite hand, you can also do that on a table or even a wall, but same concept. Usually it's nicer if you have a little wider surface here, but you can come here and resist that palm up position there. And then again, if you want to do that palm down position or your forearm pronation, same thing. Make sure that elbow's tucked in tight and then resist that motion going down into forearm pronation. All right, so that covers everything. As always, if you guys have any questions, feel free to put those in the comments, or if you have ways that you do these differently, just let us know. We love learning along with you guys. Until next time, we'll see you guys later. Hey guys, thank you so much for taking time out of your day to watch this video. We hope you learned something today and that this was helpful to you in some way.
So our goal for this channel, The Upper Hand, is to give you guys the upper hand as you seek to better understand conditions of the upper extremity and just all topics related to occupational therapy in general.
So please take a second out of your day, make sure you like this video and subscribe to this channel so that you can be sure that you're going to see all of our upcoming videos. Thank you guys so much, and we'll see you next time.